A dangerous illness? Throat cancer can affect the oropharyngeal, back of the mouth and throat, laryngeal, voice box, and hypopharyngeal, bottom part of the neck, areas of the throat. It frequently begins with mild symptoms, but can worsen quickly, so early detection is essential. In this video, we are going to tell you the warning signs of throat cancer. So let's get started. 1. Persistent sore, throat, or hoarseness. A chronic painful throat or hoarseness that does not go away, even with treatment, is one of the most prevalent early indications of throat cancer. If the symptoms last more than a few weeks and there is no obvious reason, like an upper respiratory infection, this is especially concerning. A malignant growth in the vocal cords may be the cause of the voice sounding weaker or scratchier than usual. 2. Difficulty swallowing, or a feeling of a lump in the throat. Patients with throat cancer may have a lump in their throat or feel as though something is caught in their throat when they swallow. Known as dysphagia, this symptom is frequently caused by tumors pressing on the throat or esophagus. Any persistent trouble swallowing, especially with solid foods, needs to be looked into by a medical practitioner. 3. Unexplained weight loss. Unexpected weight loss may indicate a number of malignancies, including tumors of the neck. Cancer may result in changes in metabolism, or an appetite that makes it easier to lose weight naturally. See your doctor if you have lost a considerable amount of weight and are not actively attempting to lose weight with diet and exercise. 4. Persistent cough. One should be concerned if they have a persistent cough that does not clear up and is not associated with an underlying respiratory illness like allergies or asthma. A persistent cough may result from irritation and partial obstruction of the airway brought on by throat cancer, which the body uses to try to remove the impediment. To rule out more serious illnesses, it's crucial to discuss any chronic cough with a medical practitioner. 5. Ear pain. Particularly in the early stages, transferred discomfort to the ears might be a sign of throat cancer. This may present as a mild aching, a sudden pain, or a chronic discomfort in one or both ears. See a doctor to rule out other possible reasons for your ear pain or discomfort, such as throat cancer, if you are experiencing symptoms that are not consistent with other medical issues. 6. Changes in breathing. Significant airway blockage brought on by advanced throat cancer can make breathing difficult or produce loud breathing noises like stridor. These changes can be concerning and need getting medical help right now. But even minor variations in breathing, such as more exertion during routine tasks, should not be disregarded and call for a trip to the doctor. 7. Chronic halitosis. Halitosis, another name for persistent bad breath, has a number of causes, including throat cancer. Bad breath can be caused by poor dental care, dry mouth, or bacterial development brought on by sinus problems. Halitosis should be looked into further if it continues, even with regular oral hygiene, because it may indicate an underlying medical condition, such as throat cancer. 8. Visible lumps or patches in the mouth. Visible lumps, patches, or sores in the mouth or throat that do not heal normally can be signs of throat cancer. These may show alterations in the mucosal lining brought on by the presence of malignant cells and can be either red, white, or a mix of the two. Frequent self-examinations can aid in the early detection of such anomalies, but any questionable areas need to be examined by a physician. 9. Change in voice. Quality throat cancer can result in a noticeable change in voice quality, such as breathiness, raspiness, or hoarseness. While voice quality can temporarily alter due to common diseases, persistent changes over weeks or months may point to an underlying issue that requires evaluation. 10. Neck masses or lymph node. Enlargement. The lymph nodes in the neck may expand as a result of cancerous growths in the throat. These lumps feel firm to the touch and are frequently painless. Examined as a possible indicator of throat cancer, the appearance of neck masses or enlarged lymph nodes, especially if they are on one side of the neck, may signal the spread of disease. Knowing these 10 indicators can help identify throat cancer early on, when there is the best possibility of a favorable outcome. It's crucial to speak with a healthcare professional if you feel like you could have any of these symptoms or if something feels off with the health of your throat. For patients with throat cancer, early identification, diagnosis, and therapy can greatly enhance the prognosis.